So welcome tonight, everyone. This is our December Cup of Tea event. My name is Ivana Rostevsky. I'm the parent in research in Dr. Maris's lab at SickKids. I support the Canadian Retinoblastoma Research Advisory Board events and projects, and I'm here today to host the Cup of Tea event. So for our event today, I'm going to go through a couple of announcements. I'll share some parent and research updates, and then we're going to dive into our article summary, which will be presented by our partners, and then have a community discussion about the article. So as we're going through the article summary, please keep in mind maybe things that pop into your head that you have questions about, or if there's something maybe you want to discuss or are unsure of what something was, a topic that was brought up. So maybe jot it down if you can, and then we can talk about it afterwards. This way, at least while you're listening and thinking at the same time, you can remember those thoughts. For the announcements, I wanted to make sure everybody's aware of our retinoblastoma research community. And as I scroll really quickly through our list of attendees, I think most of the folks here already are members. Anybody who's not a member or is not sure, you could either private message me and I will check the chat after our presentations, or you could email me. But the RB research community is the best way to keep in touch with what's going on in retinoblastoma research in Canada, events that we are hosting, blogs and information about research, and a lot of other great information that is only available through this community. So please do use the link in the chat and sign up. If you are already a member, I would encourage you to share with someone else. So with another family member, with patient families, or anybody else who would be interested to join. We cover mostly Canadian topics, but we welcome international participants. And you could, aside from the link in the chat, you could visit our website, www.rbcanadaresearch.com. And on the top menu bar will be an option to join. Another way to stay in touch is through our social media. On Twitter, it's at @RB_research. And for Instagram, the same. And for Facebook, it's at RB Research. There's some information shared there, but really the most comprehensive updates are in our RB Research community. One of the studies that needs your help is finding out the psychosocial needs of RB patients and families. And this is one of the topics that's in the top 10 retinoblastoma research priorities that was determined by patients, researchers, and health professionals. Finding out the psychosocial needs of RB patients and families was ranked number 3 in importance. So our community really wants this addressed, and this study is looking to uncover what these needs are. So the link will be shared in chat. If you've already filled out this questionnaire, it is only for parents or survivors over the age of 16 and had at least part of the treatment in Canada. If you haven't filled it out, please do. And if you have filled it out or you don't fit in this particular group, you could share it with others, please. The more feedback we have, the more we can understand what the community needs. So you could email retinoblastoma.research@sickkids.ca for more information. I would also like to invite people to join the first biobank dedicated to rare pediatric eye cancer patient advocate committee. So the RPAC invites people with lived experience to attend meetings and to contribute and work on projects with the biobank. The next meeting will be sometime in the new year, but to find out more about the kinds of activities and the date of the events and how you can participate, again, email retinoblastoma.research@sickkids.ca. Events that are coming up. So the Canadian Retinoblastoma Research Advisory Board events include the annual general meeting happening Saturday, January 20th. This will be a virtual meeting. Registration is open and has been communicated. So anybody who signed up in that RB research community would have received that. We have also upcoming the RB Research Symposium on Saturday and Sunday, April 20th and 21st. And registration for that will be open soon. And you can see more information about both on our website. And I know there's probably other events from our friends, but the one that I was aware of was just a One RB World for Hawaii happening October 15th to 17th, 2024. And more information about the event can be found on the link in chat. So now we're moving on to the cup of tea information. As we start the presentation on the article we're doing, I just wanted to share a little bit of data on how we've been doing so far. So we've been hosting the cup of tea events since March 2021. We've had 11 completed cup of tea events. This is our number 12. We've had more than 100 individuals who've attended at least one event. And we've had 23 patient and non-patient partners who've hosted events. Usually there's 2 partners per event, and some have had 3 partners. And then a total of 6 retinoblastoma topics have been covered, which tells us that there's some topics that have been covered twice just because how popular they are and how much interest our community has in talking about them more and learning about them more. So for tonight's cup of tea, we'll be discussing the article, Eye-Related Quality of Life and Activities for Daily Living in Pediatric Retinoblastoma Patients. The plain language summary of this article is on our website. And the guest speakers who will be sharing this article are Genevieve McCarthy, who's a retinoblastoma survivor and president of the Canadian Retinoblastoma Society, which is a charity focused on providing peer support. Genevieve has always been interested in being involved in research, meeting other families, and learning more about the lives of those with retinoblastoma. She has attended many CRAB events, including the Retinoblastoma Research Symposium, and participated in research workshops. Dr. Margaret Reynolds is a pediatric ophthalmologist at the St. Louis Children's Hospital in Missouri and is assistant professor of ophthalmology and visual sciences at Washington University School of Medicine. One of her research interests is vision and quality of life, and wants to better understand what needs to be done to assist children with impacted vision to increase their quality of life. I welcome Margaret. This is her first CRAB event. So I'm going to stop sharing my screen and I'm going to pass it over to Genevieve to share your slides and start the article discussion.
Okay, let's get down. It's gonna let me click right in there. Oh yes, I'm gonna start right at the beginning. Sorry, everybody. There we go. Can you hear me okay? Okay, perfect.
Yep.
Thank you so much for that lovely introduction. Appreciate the warm welcome. This is also my first cup of tea. I have contributed in many ways, but this is the first time that I've done a plain language summary. So I appreciate Ivana's support throughout this process. And so a little bit to start about my story and why this topic was chosen. As a survivor of unilateral retinoblastoma, with having my left eye enucleated, I was always told by my parents that I could do anything that others could do. I believe that that was true, and I enjoyed many extracurriculars, attended camps, played sports, and took on life's challenges despite my early medical interventions. As I got older and wiser, I recognized that that was not everyone's story, and it made me curious to learn more about others' experiences. And the important topic of quality of life following a retinoblastoma diagnosis was of interest to me, and so I wanted to know more about how others had been impacted. So my topic of interest was around quality of life when Ivana came to me to discuss this research background. And so I wanted to look a little more at my ways of creating a quality experience. And I was encouraged to participate in many different sports and activities. I did baton, swimming, soccer, volleyball, scouts, everything and anything. Gained a lot of confidence, skills, identity, and learned about being part of a team, problem solving, time management, all of those skills that we all acquire through our leisure and our recreation endeavors. I excelled in some sports such as soccer, swimming, and in volleyball. And I chose to pursue volleyball as my sport, as my passion. And I played on a variety of teams. I'm probably 17 or so there on a regional team. And I was a setter and sometimes a libero as the defensive specialist, as I'm shorter. So setting wasn't always possible for me. But I attended university and played on the varsity women's volleyball team in my rookie year. And I hope that shows that it's really possible, despite monocular vision, to achieve those dreams in sport. I also wanted to touch on my professional dreams and believe that in some ways my experiences helped to shape that through my retinoblastoma experiences, helped me to shape my career. I took an undergrad in recreation and leisure studies with a focus on supporting and helping others who also needed therapeutic or inclusive programs in the ways that I did as a kid and throughout my life. I had a desire to help others find meaning and purpose when maybe quality of life wasn't as easy to come. I have a career in rehabilitation, and I support those with spinal cord or acquired brain injury. I've been doing that for over 20 years now. And I assist these clients to regain their functional abilities and redefine what their passions and quality of life might mean. So we wanted to make sure that we identified some of the definitions from the article, which might come up through our discussion. One of those will be QOL, so quality of life, which is the standard of health and happiness. Activities of daily living, ADLs, would be day-to-day abilities to do the necessary things for life, examples, brushing your teeth. Instrumental activities of daily living will be the IADLs. They're more complex than typical activities of daily living and that require a little bit more thinking, planning, in order to execute those things might take a little bit higher. So doing a chore, navigating the community, two-step commands. Visual acuity is how someone can read on an eye chart. Germline is the hereditary form of retinoblastoma that can be passed on from parent to child and from child to their future children. The parent proxy is the answer on the survey filled out by a parent on behalf of their child. Visual function or functional vision is how well someone performed when interacting with their visual environment, or how visual acuity would allow or impair a person to do their day-to-day activities. So if anyone has questions or needs clarifying throughout, please let us know. We can come back to these. So we're going to get right into the why we are looking at this topic. Okay. So the researchers aim to determine whether school-aged survivors of retinoblastoma had impacted activities of daily living and eye-related quality of life. The relation between these topics had not been explored previously. The researchers used various measures to determine these visual outcomes, demographics for our eye-related quality of life, as compared to its impact on activities of daily living among these school-aged RB survivors. The desire was for these RB kids to live fulfilling lives and offer early interventions and strategies which may be supportive of their development. When looking at who participated in this study, it's obvious that we don't have a huge sample. So 65 children whom were diagnosed at St. Louis Hospital in Missouri. They were excluded if they were under active treatment within 6 months, if they had been diagnosed with a pre-existing condition associated with cognitive impairment, compromised visual function, impaired ADLs, or had undergone bilateral enucleation. So after those exclusionary factors, they enrolled 23 children in the study, but 19 children and their parents completed surveys. Researchers administers questionnaires to childhood retinoblastoma survivors between the ages of 5 and 17. And we're going to review how they did that. So the methods here were the Pediatric Eye Questionnaire, the PED-IQ, which assessed the quality of life from the perspective of the child, which included 3 main components: the patient response, the parent response, and the parent response on behalf of their child, which would be the proxy. This questionnaire focused on 4 main topics: the visual function, social, bother by eyes or vision, and or the frustration and worry. Oh, my apologies. The role evaluation, activities of real life, the role evaluation activities of life, the REAL, assessed the activities of daily living, independent schools, and specific school deficits. And this one was completed only by the caregiver. School demographics identified the school performances, such as whether the child repeated a grade or if they needed special attention in the school settings. The visual tests were administered at follow-up appointments, and they were provided through visual acuity, eye tracking, and contrast sensitivity, which we will dive into a little bit more on which or what each of those tests mean to better understand those and how they come into play. And then activities of daily living and instrumental activities of daily living were measured on how well children, these people, could take care of themselves and live on their own. So these were the questionnaires administered and or the tests performed and the information collected to complete this study. The demographics for this was a mean age of 9.6 and 48, almost half the group was in the bilateral category, 35% female, 83 had undergone systemic chemo, and 70% had had enucleation. So we have some significant associations that we want to highlight in order to kind of fuel our discussion. So some of the most significant associations or relationships occurred between the parent worry function and the multivariable analysis associated with the quality of life showed the statistical findings between child function and visual acuity, and the remaining areas were parent focused. So for example here, in the less than 80th percentile of their peers, these RB families scored 84% of them scored high in the parent worry regarding the child's condition. 63% of the parents reported a high amount of eye care. And 57% of the children reported impact on their level of function. So these were the most statistical pieces from the quality of life survey, where they looked at relationships less than in the 80th percentile. Then the activities of daily living and independent activities of daily living looked at less than 75th percentile of the peers. And this was also really important for us to highlight, as there was almost 90, 89% were scored less than the 75th percentile on activities of daily living. In the 68% was in the less than 75th percent of the peers in the independent activities of daily living. So I think it's important here that we note that the highest scores occurred around the parent worry, parent proxy, and then the child report regarding function. Those are some of the points we want to discuss further. So here we've looked a little bit more at the relationships between the data. So given the visual impairments and high frequency of challenges of ADL impairment with these patients, it would show here that 4 out of 7 of the significant scores that were reported had relation to parent worry functions. Parent worry function was scored on the PED-I questionnaire, and had the highest relation to the outcome of the children's activities of daily living. So children scored low on visual tests, and so that represented they also had trouble with functional activities. And I think that was kind of a mute. We understood that that would make sense. The children who scored low on their visual tests would also have difficulty in their functional activities. Then the children who scored low on the eye functional tests also had parents experiencing more worry around the child's ability to function and interact with their surroundings. When the activities of daily living scored lower in specific demographics, so race, age, and laterality, and that's something we will discuss a little more as well. And then the germline positive had a report a higher burden of eye care. So this showed a worse quality of life report by parents. So again, the important parts here that we wanted to highlight is that the majority of the significant scores were related to the parent worry reports, and that the scores in the ADL, so activities of daily living, really were related more so to demographics. And these are points that we'd like to discuss further. Okay. So the outcomes here. The study concluded that school-age RB survivors experienced a decreased quality of life, and majority have an impacted ability to engage in activities of daily living. Decreased visual acuity, contrast sensitivity, and eye tracking were also linked to an impact on quality of life. And so given the visual impairments and the challenges with ADLs, it was suggested that further investigation and assessment, programming, and strategies could support these children in developing and improving their quality of life. And they also concluded that further investigation and exploration into how these rehabilitation efforts with occupational therapy could also improve quality of life for these children. Visual deficits beyond acuity also had not previously been related to activities of daily living and quality of life. So more investigation would be needed into specific visual functions and school performances in order to help increase the resources available. And of course, disseminating and sharing these research findings to the community is very important to help increase knowledge and opportunities for individuals to access the programs that are out there. So I guess from my observation, when I was reading, I felt that it was apparent that the parents' report of worry may be impacting the child's engagement. And this wouldn't be intentional by nature, however, more of an innate and protective response regarding parents' fears. And obviously, as a small and very young sample group, it's very difficult to determine accurate information on activities of daily living and quality of life, because I don't think that children are all that aware as much as the parents are. I wanted to introduce Margaret for a moment to discuss some of the other aspects of the data that might be of importance to us.
Yeah, we just wanted to show, thanks very much for having me here. We just wanted to show this slide to just kind of represent that, there's a lot of problems, but also within the cohort, but also a lot of the children did quite well. So every column represents kind of a sub-score within the quality of life questionnaire. And every row represents an individual child. And then all of the green scores were where they scored at or above average, and all of the red scores were where they scored below average. So as you can see, some of the children were doing extremely well, and then some of the children were doing less well. But you can see that a lot of these kids were doing great. And then in some of the areas, most of the kids were doing great. And so we just thought it was kind of maybe important to reflect on how well they were doing in certain areas and how, they were struggling in other areas. Most of the kids had problems in one or more areas. But just to make sure you kind of got a good idea of the overall burden experienced by the patients.
Perfect. I think that helps to clarify. I think for us, the colorful representation was helpful in that you can very much see that most of the red occurs in the middle section around the parent reports, and many more obviously in the proxy area, but a little bit less maybe in the furthest to the left, where we're really seeing most of the children's reports. So I think that was a nice representation. We appreciate Margaret contributing that extra bit that wasn't included in the article. Okay, so this is our questions and hopefully discussion. And we were looking to determine what other areas of focus could come out of this study. And some of them I think we kind of mentioned. And I don't know what your tradition is. Do you want people to just unmute and contribute, or?
Yeah, I think, first of all, you guys did a great job sharing that article. So thank you so much for that. If anybody has questions about the article or the data that was presented, we could discuss that. Or if anybody would like to address any of the questions listed, we thought up of these questions to stimulate some conversations here. So if unmute yourself and share, or if you prefer to do a hand raise virtually.
Could I ask a question of number 1? The additional topics of focus. What can be done to reduce the number of areas of red and make them more green in how we manage families going forward?
Yeah, absolutely. I agree. This was a big thing that we discussed. think it very much shows that there's a gap in that area of supporting the parents, the caregivers, all of those that would be reporting.
Yeah,
that's something that's very appropriate for a CRAB to move forward. And actually, we have top 10 priorities for research, but make a list of priorities for changing life of child and family.
Yeah, I actually think that was one thing I really learned by just talking to Jen, was that going forward, we have kind of created like this, we're working with some partners and kind of reaching out to schools and interviewing individuals who interact with the children in the schools and interviewing the parents about schools. But I think we were less focused on how to help the parents. And I actually think that's one thing that we probably should focus more on, but also one of the huge benefits of groups, of support groups kind of for parents, because those probably really do make a really big difference.
We're probably all biased here to agree with you.
Can I ask a question for Margaret? These were they were questionnaires, but were they interviewed as well, or was it just fill out a form? So did you get a sense that it was the parent expressing concern, or having real concern that wasn't matching the child's performance?
That's a good point. So for this specific study, we started by doing these, they're just questionnaires, and the pediatric eye questionnaire, it's 3 subsets, and it's supposed to be one subset's the parents about themselves, one set is the parents, how they think the child is kind of doing, and then for the children, they're supposed to fill out one by themselves. So some of the families we filled out with the parents and the children, if they wanted us to, like, you'd ask the questions and fill it out, but it wasn't like a formal interview. And I'm trying to remember, I think you had kind of one more question. So did we get an idea of if it was, I guess.
Yeah, I because I sit on the other side of the table, I never really know, but I wonder if a parent almost feels obliged to express concern. Somebody's asking them, are they worried about the kid? Well, of course I'm worried about my kid, as opposed to saying my kid's doing fine. And I wondered if it also had to do with what kinds of resources. You mentioned something about socioeconomic and demographics. Did it rely on the support, or was it the confidence of the parent in being a parent?
Yeah, those are really good questions and things that we talked about, and certainly areas that we should look at, I think, going forward.
And then I guess I'd like to hear what Jen has to say about those topics, or better yet, what Jen's mom would have to say about those topics, because they obviously made a choice about how to approach things with Jen.
Yeah, I think it was interesting to discuss that even in our preliminary discussions. Was, Margaret was able to really identify most of the family's specific situations. So it was like, maybe this was more a factor. Socioeconomic might have come into play with a couple of the families. Race might have been a factor. Familial support might have been a factor. There are obviously a lot of pieces of that puzzle, but I was fortunate to grow up very close to the GTA, where there were a lot of resources. We found support. Peer support was a huge piece in all of that. And a lot of this group knows, or has been also, I think, the beneficiaries of understanding how that can impact your life. I was lucky enough to, be able to engage with many of Dr. Kelly's patients over the years, and be called down to the hospital to meet families and reassure them and provide some insight. And I think that was, very important during that process. But I completely agree with what Catherine says is about, if you're asked, even as a parent myself, what's going on, or how is this, or are you worried about your child? Well, of course, we all are. But I think for the sake of this study, it also reflected that the children were then performing lower. So it was one of our, second questions really was, do we think that it's possible that, these parents' worries were hindering the children's level of engagement because they were worried? And so maybe as a parent, not intentionally, but some parents may be choosing not to push their child to, dress themselves or prepare a small meal or, take on that, independent walk in the community or whatever would have been reflected on those ADL assessments. That's what I found most interesting because that wasn't my experience. So when I read and saw that, I was really like, what do you mean 90% scored low on activities of daily living? What I kept saying what did they not score so well on? And it was just really kind of interesting to see that correlation. I believe Helen had her hand up first and then Mary.
Thanks, Genevieve. And thanks to both of you, Genevieve and Margaret, for this great summary. I'm always really impressed by studies like this that can generate this amount of data that really requires a lot of effort from the side of the patient families. There's a lot of questionnaires to fill out, as Catherine pointed out. I mean, we need this data, but not everybody has the time to do it. We're certainly struggling sometimes to get enough people in Canada, being that we're a smaller RB community. So, I'm curious from the patient families on the call now, how could we do better at supporting families to participate in these kinds of research studies? Because we need the information, but I'm also cognizant of the fact that we keep coming back to you all on these calls because you're also mostly engaging with us. There's a bigger group. So what can we do better? Does anybody have any ideas there? Or did I kill the conversation?
Not at all. I would invite anyone else that's has lived experience. I'm not sure that I know everybody on the call to be able to, I know Mary definitely would have something to contribute, but I think definitely it comes back to family support, right? And that parents need to feel that, and this was a discussion that Margaret and I had again was, often we're told, you're cured, everything's good, we've removed the eye, go on and live your life. And that's not really the case. There is more, and there are discussions, and there are supports, and there are times in your life that maybe you should be coming back to us. And so I think that maybe that's more of a discussion that, it's not just kind of like for some of us, yeah, you're good and you're done. And that's not necessarily everyone's experience. But I think that is also one of the conversations that could happen. But I would invite Mary, if you have something to contribute, love to hear from you.
Sure. I guess I'm really surprised at the results because and I guess I want to go back and ask a question with respect to that, because maybe I missed something in the beginning, but I know you talked about one of the questions that was on it was about visual acuity. So were the patients that completed the survey, was their visual acuity, really bad? Like, I mean, I guess how bad was their visual acuity? And was that more to do with kind of the effect on their activities of daily living? Or because it really throws me to think that almost 90% of the kids scored below that 75th percentile, because I guess my experience of my own family, certainly with, I mean, one of my brothers had about 5% vision. The other one had 50% or a little less. And I mean, I have, cousins who are completely blind and still manage to do a lot of things, they played sports, they played in bands, they did stuff. They certainly were able to function in terms of activities of daily living. They had no problems with getting dressed or making a meal or doing any of the things that functionally we had to do every day. And they did far beyond that. So I guess I don't, I mean, it's just, I guess I'm really, I don't know, I'm really thrown by that. So were the visual acuity results, did they impact the results on the daily living, percentage?
Yeah, definitely. That was like one of the main things that we found. And then we were kind of that visual acuity was really important. And then we were trying to tease out other aspects of vision, like contrast sensitivity. And then another thing that we looked at was saccades, because we were wondering, one of our hypotheses was like, well, maybe reading and because saccades can kind of play a role in that, but that's obviously not really addressed in the study. But those measures too, those other measures of vision, in addition to visual acuity, also played a big role in the results when according to the analysis.
Okay, so one of the other, and I know I probably shouldn't say this, but what the hell, because it is a belief that I have. Like in the past, let's say 20 years, I know here in Newfoundland, and probably, elsewhere across Canada, the push has been to kind of put everybody who has any kind of disability into the normal education route, and provide, help within, that normal school environment. But I think for things like extreme, visual problems, and also I know here in Newfoundland, this, people who are either deaf or very functionally, not good hearing. The School for the Deaf and the School for the Blind back years ago provided supports for them because they were living with people with problems, or I don't know how you want to put that. And the teachers in those environments really kind of encouraged people to step outside themselves and say, okay, you can do things that you probably think you can't do. You just have to, get out and try it. Okay. Sort of like Genevieve, your parents, I'm sure from stories I've heard, did that. And I know, my mother and her siblings who had children who were blind did that. Just as a matter of necessity, because they felt that, you can't really take a child and isolate them. You have to expose them to every situation that's, out there. And so, when my cousin, who was totally blind, wanted to ride a bike, my aunt first said, well, you can't do that. And he said, but I want to. And so they found a way, they put papers on the spokes of the bikes ahead of him, and he followed the sound. Now, did he fall off? Yes, a lot. Did he hurt himself? Yes, a lot. But when sighted people first ride a bike, they do the same thing. So why can't a person who's visually impacted still do that? Eventually you'll learn how to stay upright on the bike. We all do it. We all fall, we all scrape our knees, we all bang our heads. We all do that, whether we're sighted or not. And I just wonder if maybe we're taking children out of an environment that they are probably helped more in because they are with like problems, okay? Are we impacting them negatively by trying to socialize them in a group that they are I don't know the right word for it, because I know I'm going to say something that's not politically correct, but I just wonder if we're not doing the wrong thing, if that's part of it. And we have to do more to encourage parents to see that there you know, there's nothing you can't achieve, but you have to try. And it doesn't make any difference what a person's ability or disability is. You still have to just, you know, go for it. And, you know, and see what happens. I don't know.
Yeah, I appreciate your input, Mary. I agree. And I think that I speak for other people's thoughts that you're blessed to have parents and support who encourage those things, because I don't think that that's everybody's experience, is what I was saying and learning myself as the president of the Canadian organization. I meet people all the time that have never met someone else or spoken to someone else with retinoblastoma or with a prosthetic or anything as an adult. And I feel like that's something that they really needed, or for some reason their family told them, you know, you don't talk about it, we don't share, that was when you were a kid, you're fine now. And so there are a lot of people that don't have the experience that you and I talk about. So yeah, apparently this is what we're seeing here. And I think it's important to remember that the mean age here was 9. And these kids had had early intervention of maybe a year or 2. So I think it is relevant that there's a little bit of a delay, but it was definitely, I agree with Mary. I was impacted to see those numbers and to think that significant scoring was related to how the parents felt about the child's abilities, and that therefore that impacted the child's scoring on quality of life. So I think that's really what's important to take away, is like that, you know, the parents could be braver if they felt more comfortable, if they felt like they had the skills, if they felt like yours and mine did. So I would invite Morgan, as she has her hand up next, and we'll probably have a great contribution to this.
Yeah, so Genevieve knows exactly what I'm going to say, which is, Mary, what I think families need, and we've known for decades, is child life supports for parents and children of all and any ages experiencing retinoblastoma would benefit and cope better from support from a child life specialist, from diagnosis through to whenever they need support. I think that the resilience-based approach that a child life specialist offers families allows parents permission to talk about, you know, thoughts, feelings, fears, wonders, and worries even before they've happened. So the child life specialist can help them with adjustments to differences, disabilities, and changes following treatment, and can help families through a resilience-based approach do exactly what you're talking about, Mary, which is not feel limited by the differences and changes that have taken place as a result of the child's retinoblastoma and their treatment. So this is something it's the hill I'm going to die on, right, guys? Because I will always continue to advocate for child life for all children upon diagnosis and their families when they're dealing with retinoblastoma. I just think that it's the right type of playful approach that very young children and families need when they're facing a serious illness like retinoblastoma. It's just not, sadly, not consistent for our retinoblastoma population at all.
And I think one of the things, like, you know, when I keep going back to, you know, in my mind, what could be done better and when, you know, because I know at first when a child is first diagnosed, I mean, you know, as a parent, you're just trying to deal with all of the medical stuff. And then you're trying to deal with all of the practicalities of what you have to do as a parent and how you have to you know, deal with your child. And obviously, you know, during treatment, that's where your focus is. But at some point, you know, your focus must go to, you know, how can this child survive, you know, in the world? And that's when I think, and I don't know, I mean, that might be different for, you know, many different patients and clients and families, but it needs to be an important part of the treatment of, you know, how how we can get parents to see that, you know, there's lots out there. There's lots of support. There is, you know, even just talking to, well, I suppose the thing is how do we hook everybody up? And, you know, Genevieve knows that's a problem. But, you know, it's important because if you don't do that, then you're seeing some of these results, which I think is, I don't know, I just think it's a shame because I think we can do better. I just don't know when you introduce, you know, that type of parental support and knowledge that, you know, your child can probably achieve more than you think. Um, you know, when does that happen, and when do you put that into the plan, and who puts it into the plan, right?
Absolutely. I appreciate that, Mary. I think that, well, I will also join Morgan's Hill because, you know, that is what led me to the career of support that I have as well, is providing others with the type of experiences that I know I benefited from and that type of exposure. But once I met Morgan, it really opened up my eyes to what else could have helped us, what else could have occurred during that process that we're gaining, obviously, as a community, knowledge around what that support needs to look like. But there's so much more that we could be doing. This is obviously a medical challenge in the beginning. There's, you know, a lot of new language and dynamics and decisions. But then, of course, there's the emotional side of it, and not just having that child survive, but how do we support them to thrive in their life, be the best version of themselves, and create mastery, create confidence, create self-esteem. And for me, that came through sport, groups, clubs, belonging. And so, you know, I think this perfectly leads actually into our third question, that, you know, if, like Mary was saying, you know, some of these discussions that we can introduce informations to families, we can provide them with lots of background on who's out there to support them. But sometimes familial standards or cultural influences can take precedent in decision making and in the way that children are raised. And so maybe that's also a factor here. And so that was also a topic that we wanted to introduce, if the possibility that the demographics could be more related to the scores on ADLs could have to do with familial standards and or cultural expectations that maybe we don't know everybody's specific story. But I see that Caitlin has her hand up, so I would love to introduce Caitlin.
Thanks, Genevieve. I am, others may know the answer to this, but I'm just wondering, because I also find these findings a bit surprising. Could it be that perhaps the decreased activity or ADL scores rather would be seen in others not affected by RB? Like, could this be a generational consideration that perhaps children of this age are less independent than others? Like, I'm just wondering if we were to compare this to controls, would we find that significant difference in the RB population versus other children? I know visual acuity was found to be correlated to the ADL scores, but yeah, it just left me wondering if there's more going on here than just the RB.
I guess I could say, like, theoretically, they were supposed to be matched for age, but as you said, it's a small sample size. So maybe there, you know, could there be something that was at play? You know, I don't know. Yeah, they're like school systems, or, you know, maybe we pulled people, you know, there definitely could be something else that we didn't control for that could be at play. And I think that was kind of why we asked the question from the get-go, was there is some data that shows that RB survivors, you know, like might not go as far in school as a group, but this RB is not associated with it's associated with a normal IQ, so there's not any reason that these kids should have you know, decreased ADLs and things like that. And so basically I think we're trying to maybe figure that out, but
I think there's even some literature, although I'm not expert in this, to say that there are some, I think there's some small case series or other groups that have shown that RB patients at times actually excel compared to their cohorts in certain types of executive functioning and other measures. So
yeah, and I think there's this
body of literature.
I think there's a study that maybe they shows that RB patients have like a higher IQ. I've heard that before, and yeah, so there's definitely a fair amount of.
Okay, with our last 2 minutes left, Dr. Payton, if you have a last question to ask.
I did, and it's partly reflection on having been at an European center recently, which made me think back about Brenda and the lab and exposure to people who are functioning, who've just happened to have retinoblastoma. So I was at a clinic where clearly the person who's doing the intake and organizing has had retinoblastoma and enucleation. Doesn't exactly talk about it, but would probably talk if asked. Brenda's had folks working with her, working in the lab, doing other kinds of things. So those are examples that people get to see. And I wonder if so many of these families had seen nobody functioning out there in the real world. I had one dad who kept asking me if the child could go to Harvard. And it's like, I don't know, but they can probably go to university if they work hard and if they've got the, you know, like it was so focused on the fact that this was going to be the only component in life that actually stood in their way as opposed to being a piece of a whole. And so the unspoken examples that people have, including from this and other things, I think are enormously helpful. And maybe we need to do a better job of ensuring that people are out there. Sounds like Jen and her family have been out there supporting others, and maybe that's a really key component.
I think maybe to wrap up on that comment is having groups like our Canadian RB Society and CRAB, and having these events where families can get together and see different people functioning, and often there'll be adults there. And I know I enjoyed when Jen attended our RB symposium and talked with the kids and brought all her prosthetics to show, and it was something different that maybe people wouldn't have seen before. So having events and organizations like this, so share this information with others and other families so they can know to attend and know where these groups are. And I would agree on that as a parent, that after we saw an RB adult, did we start to feel like, okay, it's going to be okay. And it wasn't that, yeah, it's like Dr. Payton said, it's like seeing somebody functioning kind of breaks that barrier of thinking. Genevieve, why don't you wrap it up for us as we say goodnight?
Great. Well, thank you so much. We've had some lovely discussion, and I'm sure we could continue all night. And so, thank you to the CRAB team for helping to put this together. And I appreciate Margaret working with us as one of the authors of the article that we've reviewed. And that was a treat. And thanks everybody for joining us.